Good morning.
Good morning.
Before changing a dressing, pre-medicate the patient as ordered to ensure that the analgesic will take effect in time for the dressing change.
41568.
Okay. I'm going to change your dressing today. Would you like something for pain?
Yes.
Okay.
Ensure the patient's privacy and put on a gown, goggles, and a mask as needed if the risk of spray exists.
I'm going to start your dressing change. Can I check your ID band? Repeat your name and date of birth.
George Coulter, 41568.
Position the patient comfortably and drape him to expose the wound site only.
Can you roll towards your side rail?
Also place a waterproof pad under the patient near the dressing site.
Great.
Then form a cuff on a waterproof biohazard bag and place it on the bed. After putting on clean gloves, remove the tape or bandage or release the Montgomery ties. To remove tape, hold down the uninjured skin, pull the tape parallel to the skin and toward the dressing, or in the direction of hair growth in a hairy area, and remove any adhesive that remains on the skin. Using your gloved hands or forceps, carefully remove the outer dressing and then the inner dressing, keeping its soiled surface out of the patient's sight. If a drain is present, avoid putting tension on it and carefully remove the dressings one layer at a time. Discard the soiled dressings in the waterproof bag. Thoroughly examine the wound. Note the wound's size, any surrounding redness or swelling, and the amount, color, odor, and type of drainage. Describe its general appearance and signs of healing to the patient. Dispose of your gloves in the bag and perform hand hygiene. Open the sterile dressing tray. Place your sterile drape and arrange your dressing supplies in the order to be used. Then open the prescribed cleansing solution and pour it into the tray. If you'll be using forceps, put on clean gloves. If not, you may need to put on sterile gloves, depending upon the type of wound and facility policy. Then cleanse the wound, working from the least contaminated to most contaminated areas, such as from the wound edges out to the surrounding skin. Use a separate gauze pad or swab for each cleansing stroke. If the patient has a drain, use a circular stroke starting near the drain and cleansing outward and away from the insertion site. Now use dry gauze to blot the wound with the same technique you used for cleansing. If antiseptic ointment is ordered, apply it using the same technique as for cleansing. Then dress the wound. To apply a dry dressing, position a loose woven gauze as a contact layer. On top of this, apply a thicker woven pad, such as a SurgiPad or abdominal dressing. If a drain is present, use a pre-cut split dressing. Place it carefully and apply additional layers of gauze if needed. To apply a moist to dry dressing, first perform hand hygiene and apply sterile gloves. Place a woven mesh gauze or a packing strip in a container of sterile solution and moisten it completely. Next, wring out the excess fluid and apply the moist, fluffed, woven mesh gauze directly onto the wound surface without letting it touch the surrounding skin. Make sure any dead space is loosely packed with gauze. Don't pack the wound too tightly or let the gauze extend past the top of the wound. Then apply dry, sterile gauze over the moist gauze. And cover that with a SurgiPad or other thick woven pad. Next, secure the dressing by applying tape or Montgomery ties. If using tape, apply a skin barrier and make sure the tape extends past the end of the dressing, sealing the dressing edges. If using Montgomery ties, place the bands or ties over the dressing. To secure, lace the bands or ties across it snugly enough to hold it in place, but not put pressure on the skin. Or use a stone adhesive or hydrocolloid window. To do this, cut a stone adhesive or hydrocolloid pad into strips. After applying a skin barrier, apply the adhesive strips to 2 or 4 sides of the wound.
Give yourself a little more space on the side toward you. You're getting pretty close to the cut.
Then apply the dressing and secure it with tape. On a piece of tape, write your initials and the date and time of the dressing change in ink. Then place this tape on the dressing.
Hi, Mr. Coulter. I want to check your dressing.
As part of your follow-up care, inspect the patient's dressing at least once every shift or as ordered.
Okay.